So my name is Dr. Vinay Madan with the Chattanooga Heart Institute. I'm board certified in interventional cardiology, which is a subspecialty within cardiology that uses minimally invasive techniques to diagnose and treat various forms of cardiovascular disease. And it wasn't actually until I became a cardiology fellow that I realized my true passion within cardiology, which was treating patients with coronary disease. Encountering patients with a heart attack was really a transformative experience in the sense that they're sitting there on death's door in terrible pain in one moment, and after we do our procedure and fix their blockage, they're completely chest pain free minutes later. I think once I experienced that multiple times, I realized I'd found my true calling in cardiology. The disease that I more commonly treat is coronary heart disease, which is caused by plaque buildup in the walls of the arteries around the heart. Patients with this disease can present in a variety of ways, but typically experience some sort of limitation in their ability to do physical activity, be it chest discomfort or shortness of breath. And depending on their symptoms and the results of some non-invasive tests that we have at our disposal, we may decide that they need a cardiac catheterization. And in doing a cardiac catheterization, we access an artery either in the groin or more commonly these days through the wrist, and inject dye into the vessels around the heart using long, thin, flexible catheters. If we find an obstruction, we often have the opportunity right then and there to fix the obstruction with a device called a stent, which is essentially a wire mesh tube delivered over a wire and deployed with a balloon. And this serves as a scaffold and hugs the wall of the artery, keeping the blockage open and restoring blood flow to the part of the heart muscle that was previously deprived of it. So it gives me a lot of pride to be with such a great group of physicians here at the Chattanooga Heart Institute. I've found myself to be very privileged to be surrounded by a group of well-trained and very thoughtful physicians. I feel that I wasn't really wanting to compromise when it came to quality of patient care, and I've been very fortunate to have joined a group of physicians that really puts a primary focus on evidence-based medicine and delivering the highest quality of care to our patients.